Hello, and a warm welcome back to our channel, where we explore the important health signals our bodies send us every single day. Have you ever experienced a strange, cramping ache in your calf while walking up a hill? Or noticed that your feet always seem to be colder than the rest of your body, even under a warm blanket? We often dismiss these little things. We blame them on a bad night's sleep, getting older, or just a draft in the room. But our bodies are incredible communicators. They are constantly sending us messages, whispers at first, that can grow into shouts if we don't listen. Many of the most serious health conditions, like heart disease, don't just appear overnight. They are the result of a slow, silent process that builds over years. And one of the most important of these conditions is atherosclerosis, or what we commonly call clogged arteries. While we often associate this with the heart, this process can happen all over our bodies, and it has a very peculiar way of sending a warning sign. Not to your chest, but to your legs. Today we are going to talk about a silent sign of a clogged artery. It's something you can physically see on your own legs, yet a vast majority of people have no idea what it means. It's not painful. It's easy to ignore. But according to medical literature, it can be a critical early warning from your circulatory system that something needs your immediate attention. If you believe that understanding your body is the key to protecting your health, then you're in the right place. Go ahead and click that subscribe button and turn on notifications, because our goal is to bring you these vital health insights every single week. You won't want to miss what's coming next, so get comfortable and let's learn to read this important message your body might be sending you. Before we reveal the sign itself, it's crucial to understand what's happening on the inside. What does it actually mean to have a clogged artery? Imagine your arteries are a vast network of flexible, smooth superhighways designed to carry oxygen-rich blood from your heart to every single cell in your body, your brain, your organs, your muscles, and yes, all the way down to the tiny capillaries in your toes. Now, over time, due to risk factors that are very common in our modern world, like high LDL or bad cholesterol, high blood pressure, smoking, and chronic inflammation, sticky substances, collectively known as plaque, can start to build up on the inner walls of these highways. This process is called atherosclerosis. Think of it like a limescale and grime building up inside the pipes of your house. At first, it's just a thin layer, and the water pressure seems fine. But as more and more plaque accumulates, the highway narrows. The walls become stiff and rough. The space for blood to travel becomes smaller and smaller. This dangerous narrowing is called stenosis, and it reduces the flow of that vital, oxygen-rich blood to the areas downstream. When this happens in the arteries leading to your heart, the coronary arteries, it's called coronary artery disease, and it can lead to angina or a heart attack. When it happens in the arteries leading to your brain, the carotid arteries, it can lead to a stroke. But when this exact same process happens in the arteries that supply blood to your limbs, most commonly your legs, it's called Peripheral Artery Disease, or P.A.D. P.A.D. is what experts call a silent epidemic. The U.S. Centers for Disease Control and Prevention, CDC, estimates that about 6.5 million people over the age of 40 in the United States have P.A.D., but many don't even know it. Because it's happening so far from the heart, the warning signs are very different and often much, much quieter. So, what is this visible, yet often overlooked sign that your leg arteries might be getting clogged? Take a close look at your lower legs, your shins, your ankles, your feet, and even your toes. Do you have hair there? Most people, both men and women, have at least some fine hair growth in this area. The silent sign we are talking about today is unexplained, often symmetrical hair loss on your lower legs, feet, and toes. This isn't about normal male pattern baldness on your head. This is specifically about the hair below your knees. Let me be very specific about what this looks like. As described in clinical practice, noticeable thinning, You might see that the hair on your shins, which used to be dense, is now sparse and patchy. Smooth, shiny skin. As the condition progresses, you might see smooth, shiny patches of skin where hair used to grow. This appearance, sometimes described as atrophic, is due to the skin thinning from a chronic lack of nutrients. A sock line demarcation. For men who have always had hairy legs, you might notice a distinct line where the hair stops, almost as if you were wearing permanent socks. The hair might be normal on your thighs and upper calves, but then it vanishes around the ankles and feet. Reduced shaving frequency. For women, a common observation is that you don't need to shave your lower legs as often, or at all, because the hair simply isn't growing back with its former vigor. Now, it is so incredibly easy to dismiss this. The most common rationalization is friction from socks or pants. And while tight clothing can cause some minor hair breakage, it doesn't typically stop the follicle from growing hair altogether in such a widespread pattern. Other people blame it on aging. And because it doesn't hurt, it doesn't raise any immediate alarms. It doesn't send you rushing to the doctor. That is precisely why it's called a silent sign. It's a quiet visual cue, not a loud pain signal. But the physiological reason why this hair loss happens is what makes it such a critical clue to your systemic vascular health. So why on earth would clogged arteries in your legs cause the hair on your skin to fall out? The connection is a direct lesson in biology and resource management. Every single part of your body needs a constant, uninterrupted supply of oxygen and nutrients to function, repair itself, and thrive. This includes your hair follicles, the tiny, complex mini-organs embedded in your skin that are responsible for growing hair. They are metabolically active and have a high cell turnover rate, meaning they are hungry for blood flow. When your arteries are clear, your blood flows freely, delivering everything those hair follicles need to go through their normal growth cycles, the anagen, catagen, and telogen phases. But when peripheral artery disease develops, and those arteries in your legs become narrowed, the blood flow downstream is restricted. This state of insufficient blood supply is known in medicine as ischemia. Your body, in its infinite wisdom, must start making tough decisions. It has to ration its limited supply of oxygen and nutrients. Think of it like a city during a severe drought and power shortage. The city will divert all available water and power to the most critical infrastructure, hospitals, emergency services, and residential homes. The last things to get resources would be non-essential services like public swimming pools, decorative park fountains, or car washes. Your body does the exact same thing during ischemia. It prioritizes sending its limited blood supply to the essential tissues needed for survival and basic function, like your large leg muscles and nerves. The skin, and specifically the hair follicles on that skin, are, from a survival standpoint, the decorative fountains. They are non-essential. Due to this chronic state of low-level starvation, the hair follicles don't receive enough nourishment to sustain their high metabolic activity. They are forced into a dormant state, they stop producing hair, and the existing hair eventually falls out. This is why the skin can become shiny and atrophic. The underlying structures are no longer active. This isn't just a theory. It's a classic clinical sign documented in medical literature and taught to medical students. A review article in the journal American Family Physician on diagnosing P.A.D. lists hair loss on the lower extremities as a key physical exam finding that should prompt further investigation. It is a direct, external manifestation of an internal plumbing crisis. This hair loss, while a very specific and telling sign, rarely appears in complete isolation. It is usually part of a constellation of symptoms, all caused by the same underlying issue of poor circulation. If you notice the hair loss, you should also be on the lookout for these other whispers from your legs, which are well-established symptoms recognized by organizations like the American Heart Association. Intermittent claudication, This is the hallmark symptom of P.A.D. and affects about 1/3 of patients. It's a cramping, aching, tired, or burning feeling in your leg muscles, usually your calves, but sometimes thighs or buttocks, that is reliably triggered by physical activity, like walking, and is just as reliably relieved after a few minutes of rest. This is the sound of your muscles screaming for more oxygen than your narrowed arteries can deliver. You might notice that one foot feels significantly colder to the touch than the other, or colder than your hands. This temperature difference is a direct sign of reduced blood flow, or poor perfusion, to that limb. A medical term for what we see as slow-growing, thickened, or brittle toenails. Just like the hair follicles, your nail beds are metabolically active. Poor circulation starves them, leading to changes in nail health and appearance. This is a more advanced and serious sign. If you get a small cut, blister, or sore on your foot or ankle, perhaps from a new pair of shoes, and it takes forever to heal, or worse, gets bigger, it's a major red flag. Healing is an active process that requires a massive influx of blood to bring immune cells, oxygen, and nutrients to the site of the injury. Without adequate blood flow, the body can't mount an effective repair. You might experience a feeling of numbness or weakness in the leg. You may also notice that when you elevate your leg, it becomes pale, pallor, and when you lower it, it becomes reddish or even purplish, dependent rubor. This is a direct visual effect of gravity's influence on severely compromised blood flow. If you see the silent sign of hair loss, and you also experience one or more of these other symptoms, your body isn't whispering anymore. It's speaking quite clearly, and it's time to listen. Okay, so you've looked at your legs, you've listened to this information, and you think you might be seeing some of these signs. What is the next, most crucial step? First and most importantly, do not panic and do not self-diagnose. This information is not meant to scare you. It is meant to empower you with knowledge. Recognizing an early warning sign is a gift. It gives you the power to act before a problem becomes irreversible. Your next step is to make an appointment with your doctor or a qualified healthcare provider. This is not something to ignore or hope will go away. When you see your doctor, you can say, "I noticed I'm losing hair on my lower legs, and I've been getting cramps when I walk. I saw some information that suggested this could be related to circulation, and I'd like to get it checked out." Your doctor can then perform a very simple, non-invasive, and painless screening test called the Ankle-Brachial Index, or ABI. As recommended by the Society for Vascular Surgery, this is the first-line test for P.A.D. They will use a regular blood pressure cuff and a Doppler ultrasound device to measure the systolic blood pressure in your ankle. They will then compare it to the systolic blood pressure in your arm. The ratio between these two numbers, your ankle pressure divided by your arm pressure, gives them your ABI. A healthy ABI is 1.0 or higher, meaning the pressure is the same or higher in your ankles. A score below 0.9 is diagnostic for peripheral artery disease. It's a simple number that tells a powerful story about your circulation. If you are diagnosed, the good news is that P.A.D. is a manageable condition, especially when caught early. Treatment focuses on two main goals: managing symptoms and, more importantly, stopping the progression of atherosclerosis throughout your entire body. This often includes aggressive risk factor modification. This is the absolute cornerstone of treatment. It means quitting smoking, controlling blood pressure and cholesterol with diet and medication, and managing blood sugar if you have diabetes. A supervised exercise program. This might sound counterintuitive if walking causes pain, but it is one of the most effective treatments. Your doctor can prescribe a formal program where you walk on a treadmill to the point of pain, rest, and repeat. This process, as documented in numerous clinical trials, encourages your body to form small, new blood vessels that bypass the blockages, a natural bypass called collateral circulation. Medication. Your doctor will likely prescribe an antiplatelet agent like aspirin or clopidogrel to prevent blood clots, and a statin to lower cholesterol and stabilize plaque. The key is to view this sign not as a verdict, but as a starting point, a call to action to take comprehensive care of your cardiovascular health. Our bodies have a profound, innate intelligence. The silent hair loss on your legs is a perfect example of this, a sophisticated built-in diagnostic system designed to give you a warning before a problem becomes a crisis. It is a powerful reminder that our health is a unified system. A problem in the arteries of your legs is a sign of a systemic issue that is almost certainly affecting your heart and brain as well. The presence of P.A.D. is a major risk factor for heart attack and stroke. By listening to the whispers from your feet, you are taking care of your entire body. So, take a moment today. Take off your socks and look at your legs. Listen to what they might be telling you. It could be one of the most important health conversations you ever have. And now we want to hear from you. This community is a powerful place for sharing and learning from one another. Please take a moment to leave a comment down below. Have you ever noticed this sign or any of the other symptoms we discussed in yourself or a loved one? Sharing your experience could help someone else connect the dots and seek help. And as always, we are fascinated to learn where our community is. So in your comment, please also let us know from which country you are watching. We read every single comment. Your stories and your presence here are what make this channel so special. Thank you for taking the time to learn with us today. Be well, be observant, and take good care of yourself. We'll see you in the next video.